understand it.
What's the most popular surgery? Is it the lap band, the one we hear about more?
I think right now it is, and I think part of that is due to the way it's marketed. Although you have to say, you have to understand the gastric bypass has certainly been around the longest, is still the worldwide gold standard, I would say, at this point.
Okay, let's go to some questions and then we'll go back to some of these other topics. But this is Amy. She says, I have a BMI of 45 and I have had multiple abdominal surgeries. Could I still have bariatric surgery, Dr. Georgescu?
Actually, from my point of view, these are the type of patients that, in some regard, fit with my background. I've been doing surgeries for many years, and I think I've done thousands and thousands of surgeries, and I've seen a lot of what could happen inside of the abdomen. And, of course, for the last 20 years, I do a lot of these surgeries laparoscopically. So I do recognize the possibilities of tricky circumstances in which you can encounter going into somebody who had already prior surgery. Majority of these patients do require some additional education, counseling. You may even need to adjust their initial thoughts about the type of surgery that they want, depending on the type of surgery that they had. So from my point of view, in our program, I definitely welcome, and I do actually recognize these specific, maybe more difficult cases, and take additional type in the education and guiding the patients through understanding what type of surgery is more fitted.
Sure.
The answer simple is yes, they do benefit of weight loss surgery for the most of it.
All right, Dr. Perlman, here's one from Billy. What foods can you no longer eat after this surgery?
Well, we try very hard to not say to patients you can never have, because as you know, the first thing that you think of when someone says you can never is that you want that.
Exactly.
So we try very hard to not say never to anything.
Right.
There are foods that do tend to cause problems in the long term, and primarily those foods would be the white foods, the carbohydrates that are part of the problem to begin with.
Exactly.
So the pastas, the breads, anything that's going to get sticky when it's clumped up in this very small stomach pouch.
Okay.
Sometimes steak is a problem. Obviously sweets we'd like to try to avoid, but again, that's one of the no-never foods.
Right. Here's one that might be tough to answer since you don't know this patient, but Yolanda wants to know, I have a strong family history of stomach cancer and I'm obese with a BMI of 50. What type of weight loss surgery should I choose?
Actually, this goes back again in kind of my backyard, to say so, because in the initial part of my career, and I still do, I did focus for many years of cancer surgery. So I've done a lot of cancer surgery, and from that point of view, I would say that this is actually very good question, because when we do bariatric surgery, we do modify the digestive system. In some of them more drastic, in some of them less. As Stacy mentioned, the lap band is the least invasive, the less aggressive one, the one that actually does allow us to continue to survey the stomach. If somebody has a lap band and has a concern with the possible stomach, we can still go inside of the stomach to visualize.
Sure.
But as we discussed earlier, if we do a bypass, if we cut the upper part of the stomach and disconnect from the rest of the stomach, actually that is a segment of the bowel that cannot be evaluated anymore. That is one of the tricky circumstances, and probably for this patient, I would not recommend to have a bypass. On the other hand, a sleeve gastrectomy, it's a segment that gets rid of some of the stomach, maybe that part of the stomach which may develop cancer later on, and still allow us to see the stomach inside, to scrutinize and to evaluate on the periodical basis. So probably for that particular patient, one of these choices is the best,
Sure.
A band or a sleeve, although, again, nobody knows 100%.
You have to meet the patient. I'm sure you have to evaluate
Right,
them.
and
It's
I'm
typical.
actually going to disagree with you there a little bit, because I think I've certainly been in this situation a number of times. We do pretty careful surveillance of our patients' stomachs, and I would actually recommend for this patient a gastric bypass with removal of the remainder of the stomach.
That is definitely an option. It
Right,
is
because
a
it
little
takes
bit
away the option of even needing to surveil.
correct. That is definitely an option, but it's not one of the what we call standardized procedures. I was trying to refer to one of the three. If we do
Right.
modify, and actually I did have several patients like this. I think it's a
and
very
I've
good
done
choice.
a few of these,
Yes.
and that's what I would recommend,
Sure.
because I worry a little bit with the sleeve gastrectomies. If you do end up with a problem with the stomach later on, you're sort of at a disadvantage because you've lost the remainder of the stomach, and so I'm not quite sure what you would reconstruct with. You'd have a little bit of a difficult reconstruction, whereas this would sort of take care of the problem in one step.
Sure.
without having to worry about it later at all.
Sure, and again, people need to know you certainly cannot diagnose by a question.
Absolutely.
You have to meet a patient, and everybody's different, so you have to go that
Definitely.
way.
It's a very good question.
Sure, and Lindsay wants to know, what is the success rate for this type of surgery on a teenager? Do you have such a figure, a success rate?
Actually, the success rates are similar to those of adults. Now, you have to remember that when you're talking about bariatric surgery in teens, the data is limited because it's short term. We haven't been doing bariatric surgery on teenagers for a very long time because it's a very difficult and controversial thing to talk about, taking a very healthy child and operating on them without the acute need to do so. Yeah. But we are looking at success rates in the same realm as those of adults, with 65% excess weight loss, 70% excess weight loss. Again, it depends on the surgery that you choose and the program that you choose. And that's one of the things that we certainly want to make clear is it's not the surgery necessarily that gives you the success. It's the preparation for the surgery, the follow-up after the surgery.
Well, and
what we do is
there are
such a
lifestyle
small part.
changes too, aren't there? I mean,
Absolutely.
you can have surgery, but if you don't change your lifestyle and you don't learn to eat correctly and you don't avoid some of the things that you just talked about, I mean, aren't you still in the same boat?
From that point of view, I think it goes together. The children, I mean the teens and the adults, they should understand that the surgery is really what we call it, just a tool. That the surgery is helping people to adjust, to modify their eating behavior. If they are not committed to do this, they could actually beat the surgery, and that's happened in adults sometimes, and I'm sure that probably happened in children and teens as well.
Yeah, and unfortunately with children, and especially with teenagers, you're looking at situations that an adult may not encounter. The average adult is a little bit stable, they're settled, they may or may not have a career, but their day-to-day life is about the same. The child is going to school, they may be changing schools, and then they're going off to college, which, as you know, is a whole different realm of possibilities.
And the freshman whatever. Yeah.
Exactly. Yes, and they need to learn to deal with the Chinese food and the pizza parties and the bad cafeteria food. So that's an additional challenge for them. They need to be able to manage when they're going out to look for their first job in the marketplace. Right. How do they manage the dietary restrictions at that point?
So we're talking behavior modification as well.
Absolutely.
It's got to be a part of it, part and parcel.
That is what it is, yes, but it cannot be done unless they have this additional tool.
Correct.
When they reach a certain BMI.
Right. Yeah, it's definitely important to have a very structured program and a lifelong. This isn't something that they can do for a year, for 5 years, and then forget about. This is something that is going to be a lifelong cooperation between program and teen.
Exactly.